So mothers start to produce colostrum from about 20 weeks pregnancy and for the first few days after birth. Being able to express colostrum is a useful skill to have.
Breast milk is a complete and perfect food for you and your baby. It is easily digested and low volume but high in energy. If you and your baby are separated for any reason, or if your baby has feeding difficulties or health problems, you will find it easier to express your milk for your baby if you've practiced beforehand. When mothers bring some colostrum with them, it really helps both the mother and baby in the early hours and days after birth, especially if a baby is not ready to feed directly from the breast.
If in the unlikely event that your baby is admitted to the special care baby unit, having colostrum collected and frozen is very beneficial as feeding can be started almost immediately.
In the first 24 hours after birth, babies of diabetic mothers are at risk of developing low blood sugar levels. A baby needs colostrum to maintain their blood glucose levels. Exclusive breastfeeding has been shown to reduce the risk of both babies and their mothers developing diabetes later in life.
There is a consensus of opinion from all medical scientists that colostrum not only has antioxidant and antibodies, but also have live cells that prevent serious infection in the babies.
You may worry if it's safe, but don't worry. Following the suggestions to express for a few minutes each day is unlikely to trigger labour. I would suggest discussing with your healthcare provider to ensure you're not at risk of early labour. If you experience any uterus cramps, contractions when expressing, stop immediately.
Hand expressing can be started from about 37 weeks pregnancy following discussion with the team caring for you. It helps to be warm and relaxed, so you could practice in the bath or the shower first. Wash your hands with soap and water. Massage your breast to help the milk flow. This helps stimulates the letdown reflex, and you do this for about 5 minutes. Then hand express from both breasts. Place your fingers back from the nipple. Walk them back to where you feel the texture change. Put your thumb above and your index finger below the areolar area. Gently push the fingers and thumb pads back and hold briefly. Release the breast tissue. Repeat this in a rhythm. Rotate the fingers around the breast to express other areas. When colostrum is dripping easily, this is the best time to collect it. Express both breasts during each expressing session, and take care not to cause pain or discomfort. Some people aspirate the colostrum directly into a syringe. If you find it difficult to collect your colostrum like this, express into a small clean container and draw the colostrum up into the syringe. You can express up to 4 times in the day for about 5 minutes at a time. Once you've expressed for the last time that day, seal the syringe with the cap and put it in a Ziploc bag or a storage container. Label with your name, medical record number, date of birth, time and date before placing it in the freezer. When you're coming into the hospital, bring the frozen colostrum in a cooler bag with an ice pack and hand to a midwife to place in the freezer. And once the frozen colostrum is defrosted, it must be used within 24 hours. So storing in the freezer is more sensible. When your baby is born, they will be placed skin to skin and ideally breastfeed within the first hour of life. And your baby needs to breastfeed at least 8 to 12 times in 24 hours in the early days. If for any reason you are separated from your baby or unable to breastfeed, your colostrum can be defrosted and given to the baby 1 container at a time to avoid waste. Babies' first feeds are small, about the size of a teaspoon, but every drop you get is helpful and will be given to the baby after they're born if they're not feeding well at the breast. It is important to know the studies have told us that 1 in 5 people who try antenatal expressing do not get any. It's no indication of a low supply. Once your baby is born, placenta is delivered and the hormones kick into action, your colostrum will flow. Antenatal expressing is not to add any stress to you during your pregnancy. I've met lots of women who could not get anything during pregnancy and had no issues with breastfeeding after birth. However, it's a useful skill. It can be really helpful after the baby is born, and it's one less new thing to learn. If you have any questions, please ask any of the team caring for you.